Increasingly, more companies are now implementing mandatory vaccination policies in the workplace. A top local law firm has announced that from 1 April, those who are not fully vaccinated will not be allowed into their offices. Old Mutual was one of the first companies in South Africa to opt for mandatory vaccination, making the announcement in November last year. Let's discuss mandatory vaccines with UKZN Research and Innovation Deputy Vice-Chancellor, Professor Mosa Moshabela. Thank you so much for your time, Prof. We do appreciate it. This is going to be a broad discussion around mandatory vaccines and government's stance on this. But I want us to start off with where we are in the country with our vaccine numbers. Many are saying this is a worrying picture. Government should have done more to educate those who don't want to get vaccinated why they should get vaccinated. Are you worried about the number of vaccines we have administered to date in the country?
Greetings, Heidi, and to the viewers. Thank you for the invitation. I think that the numbers that we have managed to vaccinate in South Africa, we've actually made good progress in my own view. When we're looking at the total numbers, for example, if you look at the people that are above 60, we are nearly at 70%, and the ones that are above 50, we are nearly at 65% and above. So in a way, if you look at the population above 50, we have had good progress, and that is the population most at risk. I think we can still do a good job of increasing those numbers further. But I think overall, especially amongst people who are younger, below 34, that's where we need to increase our efforts, especially the male young people below 34. And I generally think that we need to have better strategies. The total number is not so much a concern. The daily numbers for me concern me the most. We have really gone low in terms of how many people take up vaccines on a daily basis, and we've got lots of doses. I think that we need to really consider seriously the vaccine incentives that South Africa can actually adopt in order to encourage people to vaccinate.
You speak about vaccine incentives, but many are raising the question as to whether or not government should consider mandatory vaccines. What are your thoughts on this?
Yeah, I think that in general, it depends what we mean by government adopting mandatory vaccines. I think generally in the country, government has already supported a mandatory vaccine. If you saw the gazette from the Department of Employment and Labor, that essentially, opens the door for companies and employers to be able to implement mandatory vaccination. And in this case, I also find it interesting that some of them who are actually encouraging vaccination are not calling it mandatory vaccination. So they would expect an employee to have a vaccine certificate. If not, then they expect them to show weekly negative PCR test for COVID-19. Which means that they still have an alternative not to vaccinate, but they must then carry the costs of weekly testing and they must show that they are negative. So in a way, I think that the country is moving in that direction, Heidi. And I also saw the gazette from Health that shows that it's opening a door. It talks about if there is a risk, mandatory prevention can be imposed. So to speak, I think for me, it's starting to open the door for mandatory vaccinations, even from the health side. So as a whole, I think that we are definitely moving in that direction, especially for those that are in the employment sector. For the rest of the population, I think that is still very much debatable.
Certainly. I want us to speak about the fact that the President announced last year, December, if I'm not mistaken, when Omicron decided to arrive in South Africa, and there was a lot of panic about whether or not government was going to impose harsher restrictions because of how fast Omicron was spreading. And the President said that he's going to establish a vaccine committee, a mandatory vaccine committee. But nothing much has been said around that, and many are questioning why government has decided not to really focus on this and not say much as to whether or not they're going to continue with this committee, what their stance is on mandatory vaccines. We know the Department of Health has come out to say that they have released this for public comment. But why do you think government, I wouldn't say has made a U-turn, but has not really said much? They've just gone mum on the matter.
Yeah, no, I don't think it's a U-turn. I agree with you. And I think that in a way, the silent diplomacy is something that our government has taken a lot, and they wait for to see which direction things are going. I agree. It's actually disappointing that we didn't have clear direction. Even in different sectors, we would have hoped for government to provide more clarity. But I suspect, Heidi, given the court cases that came out last week, where we saw a number of rulings for roads and for another private company, essentially the courts supporting mandatory vaccination, I think that even the government is going to come out and be more explicit about the support for mandatory vaccination, especially in the labor sector. But I don't necessarily expect them to take sort of leadership and provide those guidelines as we had expected. We did not see that, and I don't think that on their own they would have done that. But now that we are seeing this sort of patterns emerging from the courts, I expect that they would be much more vocal about it.
I want us to move over to the fact that the national state of disaster has been extended for another month once again. And the big question here is, shouldn't we rather be looking at ways to deal with this pandemic and not just keep extending it?
Yeah, no, I think that in a way, I agree with you. We shouldn't really keep extending it, but we have to deal with two things, Heidi, and I think that we are starting to see a separation of those two issues. One is that the national state of disaster was introduced in order to address the pandemic, and the pandemic is still ongoing. And so the definition of when the pandemic ends is contentious globally, and it has not been declared yet, even by the WHO. And for that reason, it makes it seem that there's no need or rationale to end the state of disaster. But locally, we know that the national state of disaster is hampering many other sort of activities in society, and it's important that we end it, even in terms of just the mistrust that it has created, people thinking that government wants to hold on to power. So now we are seeing a situation where the Minister of Health is now being given powers to be able to manage the epidemic without actually going through the national state of disaster. We were worried that they may not be able to work with other departments and that COCTA becomes important. But in the draft regulations that they've put out, they seem to say that they can provide advice to other departments where, for example, they need to implement regulations beyond the Ministry of Health. So it looks like they're creating a path, and I think South Africa really needs to engage actively with the draft regulations that are due for comment and with the deadline of the 25th of April. I think they're important. It's a long document of 155 pages, but I do think that we have to engage with it. There are things in there that I think they need to be unpacked and clarified.
Certainly. And then just lastly, Prof, what is your stance on the fact that Human Rights Day is coming up? It's on Monday, and many would say that it will be a human rights violation should they be forced to get vaccinated with a COVID-19 jab. Many saying that they don't have to get it. It's their human right not to get it. What is your stance on that?
Yeah, Heidi, I've always been clear that on the one hand, I don't necessarily think that mandatory vaccination is equivalent to forced vaccination. It's all a matter of semantics and how people interpret it. I don't think at any point we should be in a position where government holds people down and force vaccines in their arms. And I also felt strongly that I don't think that people should lose their jobs or not have access to education because they did not vaccinate. And as I said, this loophole whereby people don't have to vaccinate, but if they don't vaccinate, they must regularly show their negative PCR test. I think that for me, it's an outlet that actually gives people the freedom not to vaccinate as long as they can prove that they are negative. So I think that South Africa is starting to find the right balance around these issues of human rights and mandatory vaccination.
Great. Thank you so much for your insights and always being available to chat to us. We do appreciate it. That was Professor Mosa Moshabela. Thank you so much for your insights.